Started the webinar.
Okay. Okay, good afternoon, good evening, good morning, everyone. Welcome to the workshop for today. My name is Dr. Kendra Guilford. I am the College Director of the College of Health Sciences here in Al Ain campus of Abu Dhabi University. And we're absolutely delighted to have you join us in the workshop today. So those of you who are joining from within the UAE, welcome. Those of you who are joining elsewhere in the world, welcome. So again, I know the differences in time zones, so good morning, good evening, good afternoon, however it is. So I hope you're all doing well. I hope you're staying safe. So yes, it's my pleasure to welcome you to our workshop for today. And I'll also love to introduce our moderator for today, Ms. Harim Khanum. So let's go ahead and get this party started, shall we?
Yeah.
So as you can see, the workshop for today is Masters of Disaster amidst a global pandemic. And this is a topic that's very much dear to my heart. I am a public health professional, and I think this topic is very much timely, especially, unfortunately, given the global pandemic that we are currently grappling with. So yeah, welcome again, and let's get this party started, shall we? So the objectives of today's workshop or today's agenda, first we will explore the overlap in the variants of medicine and public health. We will identify and discuss various factors that affect population health. We will explore fundamental concepts in epidemiology, which is mainly the gist of this workshop for today, an introduction into epidemiology. We're going to emphasize the role of epidemiology in public health practice. We will discover a problem-solving approach to disease outbreaks and disaster response. And finally, hopefully, inshallah, by the end of this session, we are going to acknowledge, and hopefully you will recognize and understand the importance of the field of epidemiology in preventing disease, promoting health, and most of all, prolonging life. All right, so that's in a nutshell what we're going to do today. So I'll tell you what, I'm going to begin this session. I know this is a virtual environment, and I know some people feel a little shy sometimes, but I'm going to begin this session by posing a question for you all, for my lovely audience members. So I want you to ponder just for 30 seconds or so, ponder this question. What do you think determines the health of a population? Or I could ask it in a different way. I could ask you, what is it that you think that impacts the health of a population? Think about it for a few seconds. And if you would, please go ahead and type some answers in the chat box, and Ms. Harim will read out some of the answers. So I'll give you about 30 seconds or so, just off the top of your head. No right or wrong answer, I just want to know your thoughts. What determines the health of a population? All right? I'll give you a few seconds to think about it.
You can share your answers with us in the chat box.
Thank
And
you,
I will
Ms.
read
Hari.
it to Dr. Kendra. Yes, thank you, Dr. Kendra. Okay, we have a few answers.
What are some of the answers for me, Hari?
Yeah, I will. Tanzil says that environment. And
Okay, environment,
yeah,
very nice.
yes, and then we have another answer. It says environment, longevity, access to health and well-being, access to clean water, air, and food.
Very nice. That's a more comprehensive answer. Yes, very nice. Access to clean water, food. Yeah, very nice. Anything else?
Yes, we have another answer from Amna. The way the society is ruled, for example, if the rulers of a certain community put into consideration a way to keep their community safe and healthy.
Are
Tanzil
you
has
saying rules? Did you say rules?
rulers.
Rulers, okay. Oh, very good. Meaning the governing body of a particular place?
Yes. Tanzil has another answer. Is fresh air. And Marco says mental health and physical health.
Very nice, very nice. Anything else?
So far, these are the answers. I encourage you to write more answers in the chat box.
Excellent. No, it's okay. You know something? Thank you so much, Harim, and thank you, all of you who participated in the question. I absolutely love each of your answers, and I absolutely agree with each of your answers because you're absolutely right. So I think you can anticipate what I am about to say next. So the point is, you're absolutely right. There are so many different factors, that we have found that have an impact on the health of a population, as you all rightly said. So very nice, very nice. So I want to begin this session by emphasizing that contrary to what a lot of people believe, or contrary to what a lot of people think, I know not you all, audience, because rightfully so, I can tell you know this already, but health is much more than just medical care, all right? Health goes far beyond, it extends beyond clinical care or healthcare, or what we term as medical care. 85%, now that is a hugely significant percentage. 85% of health occurs outside of the clinical space through things like our genetics, our behavior, our environment, and our social circumstances. 85%, that is nothing to sleep on. 85% is a huge percentage. Now, all of these things, genetics, behavior, environment, social circumstances, all of these factors collectively, all of them together are referred to what we call in public health as determinants of health, okay? So again, these are so many factors. We're looking at each factor individually, but we're also looking at how each of these factors interact with one another, how they are interdependent, how they interplay, okay, and have in turn an impact on a person's or population's health. All right, so moving right along. Again, this is scientifically proven. If you search the literature and you look up anything that's referred to as determinants of health, it is very much a buzzword. It is a well-known concept in public health, medicine, etc. So what we have found that the things that determine the health of a population can basically be broken down into 4 major categories. Now you see this cute little pie chart here, okay? So look at the top, it says needs and biology, health behaviors, medical care. And what do we notice about this pie? A huge, huge piece of the pie, right, is social or societal characteristics, which includes the total ecology. So again, I want you to think in your minds, each of these categories, all right, but go beyond that and think how each of these categories interact with one another, okay? All right. Now, continuing right along, let me give you a quick definition of health determinants, all right? So health determinants, if I had to define them for you, they're simply the economic and social conditions under which people are born, grow, live, work, and age, which have a direct impact on health status. Okay? Now, I will agree with you. I know what some of you are thinking. The term itself, health determinants, does sound a little bit misleading, okay? Because these health determinants, again, we can't say that they guarantee a person's health or that they, quote, determine a person's health, but we say that they have a direct impact on health status. I want to make that point clear there. Now, these conditions, these health determinants, all of these different factors are a result of social, economic, and political forces, okay? Another point is that it's these social determinants of health that are mainly responsible for what we call health inequities, all right? I'm sure you've heard the term health equity, health inequities, health inequalities, health disparities, all right? If I define those for you, they're simply the unfair and avoidable differences in health status seen both within countries, all right, if you compare, say, one part of a country to the other, but it's also seen between countries, if you compare one entire country to another country, all right? Health disparities is an entirely separate field of study, but it is very much related to public health as well. But sorry, that's a whole nother workshop. All right, so virtually, my point is, virtually all major diseases are primarily determined by specific exposures to these conditions. All right, these conditions I'm referring to are the health determinants. All right, so again, the four major health determinants are genes and biology, health behaviors, societal characteristics, health services, or medical care. All right, so I've gotten that out of the way. I think that's pretty clear. So quickly, if I had to give you a few examples of each category of determinants, so let's say under genes and biology, and I'm sure you could think of these on your own, but okay, I'll tell them to you. So things like sex, age, genetic makeup, okay? Biological factors. These are the factors that are beyond one's control, right? I know you're thinking, yes, Dr. Kendra, we know that. Very good. So health behaviors refers to actually things that a person does or activities that the person is engaging in. Health behaviors, things such as smoking or your eating or dietary habits or your physical activity or inactivity, right? Next one, social, sometimes societal characteristics, including the total ecology. So again, this was a huge part of the pie. So you see, this includes a range of things, ranging from social issues such as poverty or discrimination, whether it be religious discrimination, gender discrimination, I don't know, age discrimination or marginalization, social isolation, those social problems, okay? But it also includes things such as where a person lives or the air, water, sanitation quality, etc. Okay, which is what some of you said when I posed that question. And in the last category, you have medical care. All right, medical care includes things like quality health care. What is the quality of health care? Whether a person has insurance coverage or not. All right, and it also includes access to this quality health care because there is a distinct difference there. Other answers could have included such as your level of education, your immunity levels, especially when you're talking about an infectious disease that we're dealing with now, COVID-19, income level, ethnicity, quality of your built environment, quality of schools, your ability to work. Actually, I could go on and on and on. This is not by any means, an exhaustive list. I'm just giving you examples of some of the major determinants. Here's a cute little graphic representation here of the core determinants of health. So there again, you see, they list culture, physical environments, education, literacy, gender. I mean, the list goes on and on and on. All right. So my point is, why I started this session with a discussion on determinants is because I want you to understand that the factors that impact a person's health are very much multidimensional. They're multifactorial. There's so many different elements, okay? Because we know for a fact that there are so many different factors that impact a person's health status, it means that from a logical standpoint, the best way or the best strategy to address these issues also has to be multifactorial. It has to be multidisciplinary or interdisciplinary, okay? It has to be a more holistic approach, or an approach by which you tackle these things in totality, all right? So that leads me into introducing you to the public health approach. That's precisely what public health is. So again, public health is very much an interdisciplinary field. So here's a cute little definition for you here. It's the science of protecting and improving the health of communities through education, promotion of healthy lifestyles, and research for disease and injury prevention. So in a nutshell, that is simply a formal definition of public health. Again, I want you to make sure you concentrate on the fact that this is a holistic approach, okay? Now, public health improves the health of the entire community, all right? So it improves the health of populations, if you will. We're talking about groups of people here, all right? What does it do? So the discipline of public health aims to improve the health of community by, number one, preventing diseases, okay? Number two, promoting health, duh, right? And number three, prolonging life. So that is our ultimate goal. We're doing all of this to prolong life, but we want to prolong a life that has a high quality of life. That's the important part here, okay? So at the very core of public health are two main points of concern, if you will. So number one is prevention, okay? And the second one is population health. Sometimes if you take the time to read in the literature, or even if you've seen some articles, say in the media, sometimes you'll see public health being referred to as, quote, population medicine. All right, that absolutely is another word for public health, population health or population medicine, okay? So what I also want you to realize, again, I told you this is very much an interdisciplinary field, right? What I also want you to take away from this session is that public health and medicine are sister fields, okay, cousins, okay, brothers, however you want to call it, okay? They are very much related. So public health and medicine they go hand in hand. There's a lot of overlap, okay? I can tell you some stories of my experiences around the world, but let's see, I talk a lot sometimes. I just want to make sure I get through this session. So public health and medicine overlap in so many ways. Again, they're sisters, they're cousins, they're brothers, whatever. So while there is a lot of overlap, okay, because the end goal is the same. But in both senses, we're trying to improve or enhance people's quality of life, their health and their well-being, which is the whole point of public health and medicine. All right. So while there is a lot of overlap between the two, make no mistake. All right. Don't get it twisted. Public health and medicine are two distinct disciplines, okay? I know what you're thinking. Wait a minute. Oh, wait just a minute, Dr. Kendra. You just said that they're sisters or cousins. Yes, I did. They are, but they're not synonymous. They're not the same thing, contrary to what a lot of people think, okay? Public health is something completely different from healthcare or clinical care. Those terms are not to be used synonymously or interchangeably, okay? All right, so I had to just go through and explain to you in a nutshell the difference between the two. All right, let's see. Public health I have here is a focus on population health. As I said, you're focusing on entire groups of people at one time, or massive groups of people, whether it's a community or sometimes an entire country. All right, so populations. All right, public health also takes an epidemiological approach. I like that word. Don't you like that word? Epidemiological approach. I'm going to talk about epidemiology in a few minutes. And I know most of you probably know, you've heard of, or you've read about the field already. So public health takes an epidemiological approach, and public health focuses on prevention. Now, if we compare and contrast public health to medicine, we find that while public health focuses on population health, medicine focuses on individual health, right? I know you're thinking, yes, Dr. Kendra, duh, we know that. Sure, I'm just reiterating this for you. Medicine focuses on a clinical approach rather than an epidemiological approach. Now, oftentimes they do go hand in hand. I'm making the distinction here, okay? The last difference here, medicine focuses on treatment. It focuses on treatment. I know what you're thinking. Dr. Kendra, there is a field called preventative medicine. Absolutely, there is. Like I said, oftentimes there is overlap, and a lot of these things go hand in hand. But in the general sense, these are the main differences. So again, medicine, if a person is sick or already ill, person goes to the doctor, goes to a nurse, or any other healthcare professional to get treatment, okay? Quite the contrary, our public health approach is, all right, instead of treating a person when the person becomes ill or sick, why not focus on preventing the onset of the illness, preventing them from becoming sick in the first place? So that is the main difference between public health and medicine. Okay, I have another question for you, my lovely audience that I can't see. All right, so can you name examples of public health activities? So in a nutshell, I've talked about what public health is, okay? Just based on the pictures alone. Think about this for a second. Okay, 2 seconds, maybe 3, and tell me some examples of any public health activities, any at all. And the same as before, please feel free to type your answer in the chat box, and Ms. Harim will tell me what you said. 30 seconds again, please.
You can leave your answers in the chat box and I will read them out loud.
Okay.
Okay, we have some answers. Muhammad says stress-free.
Says what now?
Stress-free.
Okay, stress-free. Okay.
Tanzil says HIV can be spread through used injection.
Okay.
Marco says public health awareness, yoga.
Okay, hang on, let me interrupt you, Harim. So I like the answer so far. Teaching people how to be stress-free, right? HIV awareness, very good. The other one was emphasis on awareness, very nice. Go ahead.
Hussam says that balanced meals, prevention better than medication.
Very good. So you're talking about a dietary approach here. So teaching people how to adopt healthier dietary habits, very nice, very nice. Go ahead.
Alia says breast cancer.
Okay, breast cancer. So teaching people about breast cancer, making them more aware or more knowledgeable. Very good. Very good. I like it. Anything else?
Um, Tanzil says healthy food.
Healthy food. Okay. Very good. Back to the dietary habits. Excellent.
Healthy,
Or nutritional habits. Go ahead.
yes, yes. And he also says healthy routine. Ayla also mentions mental health.
Very good. Mental health. I like that
Yeah,
too.
and there's also physical from Marco, physical activities, camps, etc. And
Physical activity or camps, right? Very nice.
yes, yeah. And Tanya says that hygiene awareness.
Hygiene awareness. Excellent. Excellent. Very nice. Anything else?
So far these are the answers.
Okay, thank you. Thank you, Hari. Thank you very much. Thank you very much, ladies and gents. Excellent answers once again. So just based on your answers alone, I could see that you very well understand the concept that when we talk about public health, we're talking about a holistic approach to improving health. So your answers were a broad range of answers. You talked about breast cancer, you talked about HIV/AIDS, awareness, dietary habits, physical activity. So yeah, very well done. How to teach people to become stress-free, mental health. Absolutely. I mean, there's so much I wanted to cover in this session today because you can tell I'm very passionate about this topic, but there's something that we call the different dimensions of health as well in public health. And you all absolutely touched on those different dimensions. So very nicely done. Excellent, excellent. So continuing our discussion on public health, just make sure you remember when you talk about public health, again, it is very much interdisciplinary, which means if you study public health, you're going to be studying 5 basic competencies or 5 basic areas, all right? Those areas are environmental health, social and behavioral sciences, epidemiology, biostatistics, and health services administration. So again, our holistic approach, our interdisciplinary approach, it makes perfect sense why a professional in public health has to be well versed in each of these areas. Okay, so again, those are the 5 competencies of public health. All right, so the rest of this session, again, because this session is on masters of disaster. So I want to introduce you to the whole field or the whole notion behind epidemiology. Again, I chose to do this topic because we are in the middle of a global pandemic. Okay, I never thought in my lifetime I would be uttering those words, and I'm sure you felt the same. All right, so epidemiology is very much so relevant, even more relevant today. So epidemiology, basically what it is simply the primary science behind or of public health. Okay, so here's another quick definition. As you can tell, I like giving you definitions. So it focuses on the distribution, the causes, and the determinants of health and disease in populations. So do you see why I started this session by talking about determinants? Okay, because epidemiology, you're actually studying these determinants and how they impact health status, disease outbreaks, etc. So epidemiology is very much a scientific problem-solving method, and it's used to get at the root of health problems in a community. So you're getting into the root of the problem, the underlying causes, okay? Again, because we're trying to prevent them from happening in the future, okay? Now, here's some very basic key terms I want to make sure you know in epidemiology. So don't go away from this session and say, oh, Dr. Kenner didn't teach us anything. I hope so. I hope you learned something from this session today. So you know what a disease is any abnormal condition that negatively affects the structure or function of part or all of an organism. All right, in a nutshell, that's what a disease is. Yeah, we know that. Communicable disease, a communicable disease. Okay, a more simpler word is infectious disease. This is a disease that's caused by specific biological agent or its product, and it can be transmitted from infected to susceptible host. There's another buzzword, susceptible. What in the world does that mean? Susceptible simply means at risk or prone, all right? So again, a communicable disease is an infectious disease. You can catch it, it's contagious. Case in point, COVID-19. It's a communicable disease, all right? Next one, outbreak. Outbreak. It's simply the occurrence of cases of diseases in excess of what would normally be expected in a defined community, a geographical area, or season. All right, that's outbreak. Now, pandemic, as what we're dealing with now. When the outbreak, all right, starts in a particular geographic area, for example, you have different cases of a disease, all right, especially if it's infectious. If the disease continues to spread to a greater area, then it becomes an epidemic, okay? If it continues to spread beyond that area, okay, to different regions and to different countries around the world, then that's when you have a pandemic, all right? So a pandemic is simply a disease or condition that spreads across regions and or worldwide, okay? So diseases are categorized in so many different ways. Again, that's another workshop. But if you think of it in terms of magnitude or how many people it affects, outbreak, epidemic, boom, pandemic, all right? Then you have another key term is the epidemiologic triangle. So there's no way I can give you a session on epidemiology without talking about the epidemiologic triangle. All right, you may have been exposed to this before, but it's simply a model. It's a tool that scientists have developed for studying infectious diseases and how they spread. Don't worry, I'm going to talk about it more in a second. And another key term I want to make sure you take away from this session is non-communicable diseases, okay? Just the opposite of communicable. So non-communicable disease is non-infectious. So it's a disease that cannot be transmitted from infected to susceptible host. Right? Easy breezy stuff, right? Okay. Now, let's talk about communicable diseases in particular, all right? Because we're talking about an outbreak investigation here. So when you talk about a communicable disease, again, this is the epidemiologic triangle that I told you about a few seconds ago. So this is a model that epidemiologists use to study and to understand how these diseases spread from one person to another, from one animal to another, from a person to animal, animal to person. You get my drift. So this triangle has three corners called vertices. You see my cute little picture here. All right, so you have the agent. The agent is simply the microbe that causes the disease. Microbe, some people may refer to them as germs, microorganisms. You know, those tiny, tiny, tiny things that you can't see with the naked eye, those are microbes, like a bacterium, a virus, fungus, list goes on. So the agent is the what of the triangle. The what of the triangle. The host is simply the organism harboring the disease. The host can be referred to as the who of the triangle, okay? And the next one is the environment. The environment are all those external factors that cause or allow the disease to be transmitted. So the environment could simply be referred to as the where of the triangle. Okie dokie. So mission, the actual epidemiologist, a person who practices epidemiology. So the mission is simply to break at least one side of the triangle. So if the epidemiologist is able to disrupt the connection, to break this connection between the environment, the host, and the agent, okay? If we are able to do that, then it's this disruption, it's this break, all right, that stops the continuation of disease. It stops the disease from spreading any further. Here's another, so you have the agent here, again, the host and the environment. All right. In a little bit more detail again, the agent is the cause of the disease. So when studying the epidemiology of most infectious diseases, like I already said, the agent of an infectious disease is going to be a microorganism of some sort. Again, simply known as germs. Could be, again, viruses, fungi, protozoa, let's see, nematoda. The list goes on. Those are biological agents that cause disease. Who? So hosts are organisms. It could be animals or it could be humans that are exposed to and harbor a disease. I know what you're thinking, animals? Yes. Okay, that's another workshop. So I've named what, 3 more workshops that I want to give you. Zoonotic diseases are these diseases that begin in animal populations, and for some reason, they jump over into human populations. So they once only affected or infected animals, and they're transmitted into humans. Case in point, COVID-19, okay? The host can be the organism that gets sick, as well as any animal carrier that may or may not get sick. The host also includes symptoms of the actual disease. Again, the environment is the where. So it's the favorable surroundings and conditions external to the host that cause the disease to be transmitted. For example, you know this already, some diseases live best in dirty water. Others survive in human blood, for example. Others, such as E. coli, thrive in warm temperatures, but are killed by high heat. Okay, so again, those are the environmental factors or the where. Now, one last component that a lot of people tend to miss with the epidemiologic triangle, but I'm gonna make sure you know this one by the end of the session as well, is time. Time is not one of the, is not among the vertices, but time can be considered in the center of the actual triangle. In the center is time. So we know that most infectious diseases have what's known as an incubation period, or the time between when the host is infected and when disease symptoms occur. Or time could describe the duration of the illness or the amount of time a person can be sick before death or recovery occurs. All right, it can include a lot of different things. Okay, so time is in the center of the epidemiologic triangle there. Now, so I've introduced this session by talking about the determinants of health. And we talked about public health and medicine, right? And we've talked about the different factors of epidemiology. Now, bring it all together, all right? What's the point of having all of this knowledge and having all of this advanced information? We're so intelligent now. What is the point of having all of this knowledge if we don't put that knowledge into action, right? So how do you master a disease outbreak or a disaster of some sort when it occurs? Well, you put all of these things together, public health, epidemiology, sometimes remnants of the medical field. You put them all together and you formulate a strategy in order to control or manage the actual disease outbreak. So epidemiology, again, goes hand in hand if you're practicing public health practice. So just like I said, you're going to discover the agent, host, and environmental factors that affect health. All right, you're going to determine the relative importance of causes of illness, disability, and death. You're going to identify those segments of the population that have the greatest risk from specific causes of ill health. Then lastly, you want to evaluate how effective were these health programs and services in actually improving population health. Did these programs or interventions or services, did they achieve what they set out to achieve? That's the purpose of evaluation. So if I had to give you in a nutshell what the public health approach is, this scientific approach, this problem-solving approach, here you go. So the first step is surveillance. In simplest terms, surveillance simply addresses, okay, what's the problem here? You have to identify what the problem is, okay? Then the next step is risk factor identification. Risk factor. Those are those things that makes a person more prone to a certain disease or illness or more susceptible. So what is the cause? All right, that's the risk factor identification. And then intervention evaluation. Oh, okay, what works? What works? And the last step here is implementation. So how exactly do you do it? How do we put all of these things into action? So again, you begin with the problem, and hopefully, if we do things correctly, the response is the actual solution to the problem. Okay. So again, here's the 4-step scientific approach that you will see in the literature, this epidemiological approach to solving these different health problems, right? So you have data collection, all right? So where you're doing things like surveillance or determining the time, place, and the person, or the descriptive epidemiology. Then you have assessment, where you are inferring or making these assumptions based on your assessment, okay? Step 3, hypothesis testing. We're gonna talk about hypotheses in a few more minutes, if we have time. Hypothesis, as you know, is simply an educated guess. It's an assumption that you make, but it's based on logic, it's based on reasoning, and it's not a fact. Remember, it has to be tested to prove or disprove your hypothesis. So you're determining the hows and the whys in your hypothesis testing. And step 4, as I said again, you have to take some action, all right? There's a saying back home, don't talk about it, do it. Put something into action. All right, so this is a 4-step scientific approach. So if you're dealing with communicable disease outbreak, let's bring this on home here, okay? If you're dealing with a communicable disease outbreak, such as the one we're dealing with now, okay? The point I want to make is that environmental factors do influence the spread of communicable diseases. Yep, you know this already. Water, sanitation, food and air quality are all vital elements in the transmission of communicable diseases and in the spread of diseases that are prone to cause epidemics or pandemics. So when you are tackling these outbreaks or grappling with these outbreaks or addressing these outbreaks or strategizing, you get my drift. The purpose of outbreak management is to protect the public's health. And the way we do this is by, 1, identifying the source, okay? And implementing control measures. And we're doing this, what? To prevent further spread or recurrence of the actual infection or the disease. Now, let's see here. So public health experts or professionals, or however you want to refer to us, are the actual people that provide the surveillance, the epidemiology, and the expertise whenever you're trying to manage a particular outbreak. So I've given you some examples of public health agencies or ministries or departments or organizations. Depending on where in the world you are, that will determine what you call them. But it all means the same thing. At the global level, as you've seen all over the news over the past year or so, right? Everyone knows now, I hope you do, the World Health Organization. That's at the international level. In the UAE, for example, you have the Ministry of Health and Prevention, you've got Department of Health Abu Dhabi, you've got Dubai Health Authority, okay? All of those organizations are responsible for surveillance, epi, and outbreak management. Back home, we have the Centers for Disease Control and Prevention, also known as the CDC in Atlanta, Georgia. Okay, hey ATL, sorry. So that's the CDC. UK, you have Public Health England, and then Canada, you got local and province-oriented public health agencies. All right, so again, these are just examples. Again, this is not an exhaustive list, but these are the different ministries or departments or organizations that are responsible for outbreak management. Okay, so how exactly are outbreaks detected? Well, the most common way, believe it or not, that outbreaks are detected is through notification from a healthcare provider or by a citizen, by an average person. So when reports of an outbreak are received, this information is what is typically gathered. So the first one, the person reporting the outbreak and the geographical area or environment. Yeah, that makes sense. Characteristics of the suspected outbreak, people that are directly affected by the outbreak, and the population that's at risk of exposure. Okay, so let's bring this whole section full circle here. So we're talking about mastering disasters from an epidemiological standpoint. Okay, so when you are investigating an outbreak, this is scientifically proven, and just about any major public health organization worth its salt, they're going to tell you about the 10 steps that are involved whenever you're trying to investigate a disease outbreak. All right. Okay, there may be a few variations, but these are the 10 basic steps. All right, you got to establish the existence of an outbreak, prepare for field work, verify the diagnosis, define and identify cases, use descriptive epidemiology, develop, evaluate, and refine your hypotheses, implement control and prevention measures. And then the last one is communicate your findings. Because again, your action, like whatever you do based on your investigation here, it has to be impactful. You want to do something that's effective. So you have to communicate your findings to other people, right? So quickly, step one is establishing the existence of an outbreak. So you're going to get data or information from several different data sources. Okay, that's another workshop too. Step two, you want to prepare for field work. You have to research the disease, right? You have to gather supplies and equipment. Think of all the things that all the professionals have done since the beginning of COVID-19, all the things that we've been doing in order to research this disease. Okay, we've discovered so many elements about the disease that we didn't know when it first appeared, but it keeps evolving. We're constantly finding out new information, which is what we should be doing, right? Steps 3 and 4, you want to verify the diagnosis by speaking with patients, for example, reviewing lab findings, clinical test results. So this goes hand in hand with the healthcare field. I told you how they were interrelated, right? Defining and identifying cases is step 4. You're going to establish a case definition, and you do that by using a standard set of criteria, but that goes beyond this workshop as well. Okay, step 5, you use something what's known as descriptive epidemiology. So they're like they call them the 5 W's of epidemiology, where you're going to describe and orient the data. So it's just the what, the who, the where, the when, the why, and the how. Okay, how is not a W, but you get my point. All right, so that's descriptive epidemiology. So steps 6, 7, and 8. Now check this out. 3 different steps have to do with the actual hypothesis. That's how important it is. So you have to develop a focused hypothesis. You have to evaluate it, and then you have to refine it as necessary. So it's very much an evolving process, okay? And steps 9 and 10. Step 9, you want to implement control and prevention measures. Okay, control, you want to control the outbreak, but you want to prevent it from recurring. Control and prevent additional cases is the point here. And step 10, the very last step, the official last step in an outbreak investigation is to communicate the findings. So you want to communicate the findings in a very timely manner. Again, you're dealing with disease outbreaks. You're dealing with people's lives here. So you have to do it in a timely fashion. Time is of the essence. So you have to determine who needs to know and determine how that information is going to be communicated. Scientific journals, media, social media, press release. However, you have to communicate the findings, but in an accurate and reliable and credible manner. All right? Now, let's see, how much time do I have? Okay, so I have this very brief video that I want to show. It's just like a minute or so, or a minute and a half. And it just talks about, in a nutshell, it summarizes, it gives you a great synopsis of what epidemiology is. All right, so stand by. Let's watch the video. I hope you can see it.
Everything in life is a negotiation. When you cross the street is a negotiation.
All right,
Getting your
Epidemiology is the study of the emergence, distribution, and control of disease, disability, and death among groups of people. It's a field that combines elements of biology, clinical medicine, sociology, mathematics, and ecology to identify and understand health patterns and improve human health across the globe. Epidemiologists are doctors and scientists who work to understand the source of disease and other negative health effects. They estimate how many people are exposed and how the disease spreads. Epidemiologists are generally associated with infectious diseases and outbreaks, such as the COVID-19 pandemic, but they also study non-infectious health problems like the prevalence of lung cancer from smoking or a community's increase in homicide rates. The Epidemiologic Triangle is a tool epidemiologists use for explaining the connection between the cause of a disease and the conditions that allow it to spread. The triangle's three corners represent the who, what, and where of a disease. Who is the host or person or people who has the disease? What is the agent or cause of the disease? And where or in what environment does the disease occur? The goal of an epidemiologist is to figure out how to sever at least one link between the corners of that triangle. Breaking the connection between the host, agent, and environment stops the disease in its tracks. In early March 2020, during the COVID-19 pandemic, epidemiologists from Imperial College London released a model showing the potential impacts of the disease if certain prevention methods were implemented or not. The scientists recommended large-scale social distancing to slow the spread of the virus and prevent millions of people from dying, thus severing the connection between the where and the who. The team's recommendations became public policy in many parts of the world and will result in fewer cases of the disease than expected had the triangle remained intact.
There is a shortage of
Okay, so, well, that's the end of my session for today. Thank you so much for attending the session. I hope you learned something from the session. I hope it was a somehow enjoyable experience for you and I didn't put you to sleep. And now I'll take any questions that you might have. Any questions from anyone, please feel free. We have roughly 7 or 8 minutes or so. So any questions from the audience?
If you have a question, just leave it down in the chat box or just raise your hand and I will allow you to talk. In the meantime, Marco has a question. He says, what about providing recommendations to the public and getting feedback from peers in the 10 steps discussed? Where does this fit in?
Repeat the question for me, Hareen.
Sure. What about providing recommendations to the public and getting feedback from peers in the 10 steps discussed? Where does this fit in?
You know something, I think, is that from Michael? Marco, that's a good question, Marco. I would say that fits into step 10, where you communicate the findings, okay? Because before you can get feedback from any of your peers or from any of the other experts or professionals, you have to have something to communicate to them, right? So yes, that's a very good question, Marco. That would fit into step number 10, the very last step. But again, remember, don't look at this as a linear process. it's almost a cyclical process. So it is a continuing and ongoing or an evolving process, if you will. Does that make sense, Marco? Very good question. I like your question. Thanks, Marco. Any other question?
Marco raised his hand.
Go ahead, yes.
You're allowed to talk, Marco, so you can go ahead and speak.
Yeah, my question was in terms of once we have the recommendations, those change on a timely basis, right? From time to time, especially here in the US, we've observed that after some time, something comes along and the recommendations change. And
Sure.
Yeah, how does it fit in? Thank you.
Sure, that's a good question. Hang on. I'm gonna go back to my lecture here. So, Marco, so your question to me, again, if you look at the outbreak investigative steps as cyclical in nature, right? And you're absolutely right. We are constantly trying to achieve a higher state of being, a higher state of existence. And scientific knowledge is very much evolving. It does change. So if you look at steps 6, 7, and 8, I think your question, again, the way I addressed it initially, communicating your findings. But if you have this new information and you're trying to say, hone your investigation based on the new information, then that will take you back to steps 6, 7, and 8, where you're having to refine your hypotheses. So this ongoing or this evolving information that you're getting, Marco, that goes back to evaluating your initial hypothesis. So that's what makes your hypothesis change. Okay, so again, think of it as these steps as being very much interdependent and evolving. So I would take you back, Marco, based on your question, these steps to where you are redeveloping and refining your hypothesis as needed. Okay, step 8 in particular. And then you go on through the steps and communicate those findings based on the hypothesis that you've just refined. Does that make sense for you, Marco?
It does. Thank you so much. So the other question I have is, if you don't mind, is
absolutely, go right ahead.
Is politics. We know
politics,
that
okay.
Politics plays a big role in healthcare, in the well-being, like especially we've observed that in the COVID pandemic. So how does that fit in within the healthcare of a system, be it UAE, or it could be England, it could be anywhere in Africa, for instance?
Sure. Another excellent question, Marco. I wish I had time to introduce you to what we call the social ecology of health. That's another different model that we use in public health, also medicine. And it's an ecological approach to a person's health, okay? Part of that ecological model, one of the major components is precisely what you said, a focus on institutions and a focus on policy and law. And as you said, politics, remember when we were talking about these determinants, we said that they're also a result of political forces. And you see this, as you rightly said, in various countries, back home in the US, UK, here in the UAE, in whichever country that you are examining, politics are very much related to healthcare and public health. All right, so when it comes to politics, that's a whole nother discipline which evolves out of public health that we refer to as health policy. Okay, so that's when you get into the political nature of dealing with public health, and you're trying to impact laws, rules, and regulations. All right, again, in a nutshell, that's just to address your question. But yes, the ecological approach to health, again, focuses on that major component of laws, rules, and regulations. which are directly related to any political system, any governing body. So again, politics is very much interdependent to population health as well. Okay, so we as citizens, we as professionals, whether you are a student, I would encourage you to get involved to the political aspect as well. If there's an issue that you feel very passionate about, that you think you could have some type of impact on, if you think it will help your community or help your the local population, absolutely get involved in those groups, those lobbyist groups, to see how you can play your own part, play your own individual role in helping to impact your community's health. Right? Very nice, Marco. Any other questions so far?
So far we have Marco. He was asking if he can have the link to the YouTube video.
Oh, sure.
Muhammad Usman said, thank you so much for the valuable session. And Marco also thanked you for the great presentation. Fatima says that, thank you, Dr. Kendra. Can you share the slides with us, please?
Sure. Harim, we'll make sure, since you are the moderator, absolutely, we can make sure that they have access to the presentation and the link as well. Absolutely. Thank you so much for your comments. Very nice comments and very good feedback. Anything else? Any other question, comment, concern, anything at all?
If you have any questions, you can write them in the chat box, or again, you can raise your hand and I can allow you to talk. I think there's a question from Tanzil. He says, those who made health policies, why these policies are not implemented in some countries?
Who asked this question?
Tanzil.
Oh, that is a loaded question. Seriously, it's going to take me 2 hours to answer that question. But in a nutshell, it goes back to what I was saying at the beginning of this session. You know, no matter how much knowledge and information we have, if we don't put it into action, it becomes pointless or becomes just words on paper. Unfortunately, sometimes that happens when it comes to public health related policies and rules and regulations as well. Oftentimes, what we find, unfortunately, and again, it's because of so many different factors that we don't have time to go into, but you're right. Sometimes what we find from country to country, trust me, you will find these circumstances in just about any country, all right? Oftentimes, what we do find is that people have good intentions and they make all of this effort to create a policy, if you will, or a rule or a regulation. And it looks really good on paper, right? But we know very well the process goes far and beyond than just looking nice on paper. And you're absolutely right. If you don't have a plan or a clear, definitive strategy by which to implement these rules and regulations that you have on paper, then unfortunately, it does become pointless and it doesn't have the impact or the effect that we want it to have. So absolutely, I think it is incumbent upon government officials, people that have any type of pull, or what we say over here, wasta, to try to impact these policies and rules and regulations to the point to where they go beyond just a policy. And sometimes it can actually become a law, to where the government actually implements that law. All right, so yeah, that is a very good question. A loaded question too. Very, very interesting question. Thank you so much. All right, well, I think we've run out of time now, but again, I really enjoyed this session with you all, and I hope you enjoyed it as well. And I hope you take away something from this session and you really internalize it, especially because we all are citizens. We all are citizens, and we're trying to achieve the same goal. So right now, it's important that we collaborate, we put all of our thoughts and ideas and our actions together and try to stop this pandemic that we're currently dealing with. Hopefully, inshallah, we will. We see a lot of progress, but there is more progress to be made. Thank you so much, everybody. Stay safe, stay well, and thank you so much, Ms. Harim. Thank you.
Thank you. Thank you everyone for joining us. Hope to see you soon.
Inshallah.
Again sometime in the future.
I
Have a
hope
nice
so.
evening.
Thanks,
Bye-bye.
everybody.
Thank you. Bye-bye.
Bye-bye.